Good morning, everyone. Good morning. Always great to begin the day with lots of energy, excitement. That's how I feel today. So good morning to all of you. Good morning. Good morning. All right, thank you. So welcome. Welcome to National Academy of Medicine and our second annual Climate and Health Summit. So many of you know we hosted our first inaugural event last year, certainly as part of a climate group, U.S. Climate Action Summit. So this year, once again, we host the second meeting. And last year, we decided to designate as the Climate and Health Day for the climate group. And I see Seema there and others helping us to get that launch. So once again, we designate today as a Climate and Health Day. Tremendous collaboration with Kaiser and with the climate group. So as you all know, today is the 55th anniversary of Earth Day, celebrated each year to reflect on the importance of caring for our shared home and protecting the environment. And more recently, the need to address impact of a warming climate as impact on human health. That's what we're about. So as we look back on the origins of Earth Day, you know, health is inextricably linked to Earth Day because it started by focusing on the impacts of air pollution, such as respiratory, cardiovascular, neurological problems, and need to improve air quality. That, in fact, is when it all began. Earth Day also demonstrates the need to come together across communities, states, parties, and countries to protect the health for everyone, everywhere. And that's what we're about. So, as many of you know, the origins of Earth Day came through fruition through bipartisan support, further illustrating how we can work together to address a collective issue on nation's health. It was then Senator Gaylord Nelson, a Democratic senator from Wisconsin, and Representative Pete McCloskey, a Republican congressman from California, came together to be co-chairs of the first Earth Day in 1970. And this started a modern environment movement. Very exciting. For 50 years, the National Academy of Medicine has worked for both Republican and Democratic administrations, and will continue to do so. As an independent, nonpartisan, tax-exempt organization, the mission of academies, that is science, engineering, and medicine, and then is to provide trusted, evidence-based advice. And we've done so for all these years and longer. This includes providing scientific information about the range of options to address climate change and impacts that it has on people, nature, places, and economic sectors. So the national academies are continued critical work to help communities, business, and government to navigate climate-related challenges. So our nonpartisanship makes us uniquely capable of rising above political divisions to do critical work on behalf of all Americans, and of course, central to influence and impact, and of course, also globally. So during this meeting, I want you to remember this. We're here to continue to work for the health of the nation and the health globally, particularly in the context of climate change. So focus of today's climate summit is health. We want to examine ways to protect health and in context of extreme weather events or chronic impact on climate change, such as air pollution, on health and illnesses. So I think today's summit will offer innovative, exemplar initiatives across the nation and creating networking and collaboration for everyone here and, of course, everyone everywhere to address this issue of climate change and health, and particularly collaborating with communities and others. So I think it's really important that we address this, and this is the reason why we launched the NAM Grand Challenge on Climate and Health in 2020. And we've been doing this for a while. As you know, this is a major initiative for us. It has 5 pillars of work that addresses innovation, communication, environmental impact, communities, and systems transformation. In addition, we have a movement, as you know, called Accelerated Climate Movement, which is, in fact, one of the largest initiatives to date in this country, mobilizing everybody collectively to address the issue of climate change as it relates to the health sector. So there's tremendous momentum. For example, we have 367 organizations in the movement, including 49 health systems representing over 800 hospitals. So I think this is so exciting. Let me just say that looking at today's attendance was in person about 300 and online over 1,600. Goes to show the nation really is looking for this coming together to say we need to address this really important issue of climate and health. So some logistics. We'll begin with an open plenary today, followed by a special plenary session, which then be followed by concurrent sessions. We'll then conclude the meeting with a closing plenary and brief remarks from Climate Group's Exec Director of North America, Angela Barranco. For those in person, 3 plenaries will be held in the auditorium. For sessions held throughout the day, 2 sessions will be held concurrently, the time for you to choose from. And the sessions will be, in fact, 1 in the auditorium and 1 in the lecture room, which you will find all together. So there's 6 in terms of sessions altogether. And for online, the odd number concurrent sessions will be live streamed and the main NAM event page, and even numbered will be available via Zoom webinar link on the NAM event webpage. I hope you got all of this. I'm just reading this information. Okay, but I want to take a moment to say how excited we are to welcome the young people. We have a youth group leaders joining us today. They're coming from the Climate Communities Network, a program, of course, within the Grand Challenge, which is also holding its meeting today. And these young people were nominated by Climate Communities Network members for being at the forefront of climate and health action in their communities. You can spot them by their purple ribbon, but maybe I can ask them to stand up. They're not here yet, okay. Having grandchildren, I know they don't get up as early as I do. All right, so we're just happy and honored that you're here. We're going to hear from you. It's going to be great. I also want to make sure that I welcome the staff from the National Academy's Climate Crossroad Initiative. This is an initiative across all 3 academies, which, of course, we won with a pillar for health and climate. And it's also, I want to really make sure I thank the wonderful staff, the director of the Grand Challenge, Chris Henley. Chris, are you here? Good. And of course his team, Jessica Marks, Emma, Kamala, Justin, Helia, Noah, Michelle, Shania, Katie, Fumi, Grace, Victoria, and Vijay. Pretty big team. So I want to thank all of you for being here. I really mean this. This is so important to us and important to the whole climate and health community and important for the nation. So therefore, I'd like to welcome all of you. And first, let's give you all a round of applause. So now I'm going to ask the panelists to join me on the opening plenary, which in fact is asking John Balbus, and let me make sure I get all your names correctly. Okay, Adrienne Hollis, and of course Howard Frumkin is going to join us virtually. Come on up. Come take a seat, I'll join you in a minute. Yeah, great. Adrienne, welcome. Okay, so some general comments. First of all, this panel will hear from 3 leading experts on climate and health, and they bring important perspectives from their diverse expertise experience across multiple sectors, from research, community engagement, to nonprofits, to for environment, and of course, general leadership and all together. And we all know that we are seeing tremendous impact of extreme weather events on human health, but also we also know, of course, there are chronic impacts from air pollution and many others. We also know that certain populations are particularly vulnerable on climate change impacts on health: children, older adults, individuals with underlying health conditions. And of course, communities which are under-resourced, and of course, low-income communities do not have capacity, like others, to adapt to many of these climate impacts. So we have to consider how to increase resilience in the face of these threats and for everyone, everywhere. So today's discussion, this panel, we will cover a range of critical themes: the role of private sector in driving change, the importance of engaging communities and co-designing solutions, and the need to strengthen research, training, and workforce pipeline that support this field. So this is an important area. As I said, today we have called this a Climate Health Day, but also this is an important year leading up to COP30, where in Brazil, where there will be health and climate will be a central theme. So it's really important to look at how to build on this momentum here and subsequently to lead up to COP30 to look at important issues on climate and health, particularly addressing equity issues, policy decisions, and achieving the Sustainable Development Goals, SDG. So I'm so excited to introduce the panel today. First, John Balbus, founder and principal of Climate Care Consulting, LLC. And of course, you'll know John from the great work he's done in this space, but also the former HHS Deputy Assistant Secretary of Climate Change and Health Equity and Director of the HHS Office of Climate Change and Health Equity, also known as OCHE. Adrienne Hollis, the Vice President for Environmental Justice, Public Health and Community Revitalization for National Wildlife Federation. And finally, Dr. Howard Frumkin, online Professor Emeritus of Environmental and Occupational Health Sciences at the University of Washington School of Public Health. So help me welcome all of them. Great. So I'm going to ask each one to make some opening remarks, then I have more directed conversations with them. So let me start with you, John. What do you see as the really promising area? I know you've thought a lot about starting in a positive way. What are promising areas? But also, what are the challenges addressing the impact of climate change on health, given the current landscape?
Thanks for that question, Victor, and thank you so much for your leadership, for your continuity, and for having this panel today, and a big thanks to everybody for being here today. I want to start by just acknowledging that this is a time of really profound loss and trauma for those of us who are dedicated to this space, for those of us who are working in academia or in NGOs or in a government, federal, state, local, or in a community group on this area. An unprecedented loss of livelihoods, an unprecedented loss of faith in our systems of checks and balances, an unprecedented damage to our institutions. And I think we just have to acknowledge that and acknowledge that we are both grieving these losses and in a state of some shock at this time. And that is in many ways one of the biggest challenges we're facing, is just the overwhelming nature of what is going on now. The attack on our movement to provide a safe planet for our children and future generations has never been greater. But the good side of that is that the movement is really strong, as evidenced by 1,600 people wanting to be a part of this, as everybody in this room. And, I think we are seeing the signs, the seeds, or, we're seeing the signs of the resilience and the resistance of our movement coming together. And that is, what gives me the most hope, is that we are seeing your institution, we're seeing private sector, we're seeing universities start to say, start to dig heels in and say, this isn't going to stop, because it can't stop. There is no plan B for the planet, right? There is no planet B, as much as people are looking at Mars. We have to dig in our heels and make sure that we find the ways to continue these kinds of operations.
Thank you very much. Howard, I think you and I talk about this, right? Looking at what's going on in pulling back on climate policy, at least for this administration, and looking at the closure of OCHI and cutting back on the budgets of EPA and NOAA. Tell me about your perspective and what do we need to do to move forward?
Victor, thank you. Welcome to everybody here. Greetings from the West Coast. It's an honor to be on a panel with Adrienne and John and you, Victor. We do indeed face challenges. I want to build on John's comments. We've seen a full-scale reversal of the nation's momentum on climate change over the past few months. Support for renewable energy and clean transportation has ended at the federal level. Fossil fuel projects are being aggressively promoted. We're exiting the Paris Accord and the IPCC. Across government, federal agencies other than HHS, whose work is essential to protecting health in the face of climate change, from NOAA to FEMA to EPA, have seen major cuts to relevant parts of their portfolios. In the climate and health space, specifically, we've seen the termination of the U.S. Global Change Research Program, the HHS Office of Climate Change and Health Equity, the CDC Climate and Health Program, the NIH Climate Change and Health Initiative. This administration has effectively halted all federal work on climate change and health, and moved to erase the concept of health equity, which is central to climate and health efforts. So the context of today's summit might best be framed in terms of crisis management, if not disaster response. But we're not here to lament, we're here to chart the path ahead. We must do what crisis management and disaster response call for. Assess the damage, to the extent possible restore core functions, communicate clearly with the public, and plan for long-term recovery.
Thank you very much. Adrienne, let me turn to you on this issue. You've done so much on environmental justice, other areas. How is this current environment affecting you?
And thank you all for the invitation to be here with such esteemed panelists. That question is, I think, personal and professional. I want to start with a quote from the late Pope Francis, my Pope, as a practicing Catholic. Everyone should act to provide a future for humanity and those who are voiceless, who are deprived of their rights. And that's what I do, right? And that's what the people that I know and interact with do. And that hasn't stopped. However, every day leaves us reeling, right? We wake up wondering what's new, what's happened, and what we need to address, what needs to be addressed. I think that the current state has shown us the importance of working collectively and in non-traditional partnerships, as well as those we've already engaged in, the importance of the law, and I'm not speaking just as an attorney, but generally, if the law is used properly, it is, our number one tool to address inequities and other unfair assaults. So I think that the current climate, if you will, provides an opportunity for us to stop and think We mourn and we're afraid and we are angry, but then we take time to think, and it gives us time to create partnerships and to think beyond ourselves and our usual colleagues and I guess partners in crime, so to speak. So,
Thank you. So maybe taking kind of your experience, John, about what do we need to do now going forward? What are your thoughts about keeping this whole momentum up? And of course, there are resources which are being cut back. How do you actually maintain this tremendous amount of momentum that we've gathered? I mean, you said 1,600 online, 300, that's 2,000 people attend this meeting.
So that is our big challenge, is how do we keep this going as especially the funding gets cut. The federal funding has been very, very important. Certainly, not just the recent federal funding, but the decades-long legislatively mandated programs that are being sliced and diced, from the BRACE program to the hospital protection program to the public health emergency preparedness programs, et cetera. And so I think one of the first things we have to do is be creative about alternative sources of funding. For private institutions that, like major universities that have endowments, I think this is a time where we go to the emergency funds, right? We're in a bit of there is an emergency right now to try to preserve and protect, these institutions and programs that are being damaged. And so we have to look to all sources of emergency funds. Part of that is going to be the savings of, our savings, our personal savings are being tapped into, and, universities and other, foundations and major institutions are this is a time to step up. I think that the private sector also has a really important role here. Certainly to dig deep to be able to continue to meet the commitments that have been made for those institutions that have made commitments. But the second piece of this, and I think everybody has said this, is we really have to double down on collectivism. We really have to double down on solidarity and being publicly together in this, because we're in a time when individual institutions, individual people are being targeted. And if we don't hang together, I won't go through the whole cliche, we do all have to hang together in this. And again, the federal government, certainly in the last administration, was a connecting force. We were conveners. We were creating cohorts with the work that we did. NGOs have done this. I'll talk more about this but we probably, we need to think, do we need, we need to strengthen and adhere to the existing commitments and existing coalitions, but we may need to create some new ones. And again, to think outside the box in terms of the partnerships and broaden perhaps the way we've been thinking about this collectivism as we go forward in these next years.
Yeah, certainly, from our point of view, we've been very fortunate to get the support from many, many people, public and private. I was so encouraged yesterday and today in talking to the people who are members of this Grand Challenge and Collaborative to say we're in. Organizations like AstraZeneca, Johnson Johnson, all the others, we're in, right? McKesson, you name it. And of course, we also get foundational support. So for us, we're going to keep moving. But I think on the ground, there's so much more needed in terms of funding for workforce, funding for the stimulus to look at how to do renewable energy. How do we move forward with this? How's it affecting you in terms of looking at the environmental issues and the community issues?
A fantastic question. Some may know I am a co-director of the Region 3 Thriving Communities Technical Assistance Center grant. I say am because we are currently disputing our termination, as most of the TIC-TACs are. But what we're doing, and this is both a great idea and a challenge, is look for alternative funding and working with our philanthropic partners. The challenge is that we're not the only ones. because of all of the cuts and the freezes and the terminations, there are a lot of people looking for a little bit of money. And traditionally, there hasn't been much money for community work. But what we're finding is that people, organizations are pivoting to not fast enough. Of course, there's never going to be the speed of Adrienne or the speed of those who need, but to allow us to focus on this work. At the same time, in this area, we're seeing a need for funding on security because there are threats to people working in this space. Not me, thank God, but people that I know have been threatened. And I feel that it's unfair that we have to focus that money on us instead of on people. And so we are using this to sort of piecemeal look at some of the issues on the ground. For example, the issues around health and evacuations, emergency evacuations. That's something I've spoken with a couple of people about, a couple of physician friends of mine about. And we're hoping to work with, if we get funded, with Ready America to develop grab-and-go kits. So that, because most of the deaths from evacuations occur after the incident. So that's what we're doing, and that's one of the things we're doing that we think people should do, is start, as they say, biting off a piece of the elephant, because that's where we are, and recognizing that there's not enough funding to focus on the entire issue.
You know, we have a initiative I mentioned called Climate Communities Network, or CCN. And last night I met with them, had dinner with them. I was feeling the energy that they all committed to go forward. And because funding is a major challenge. And we have now, from the academy point of view, going to provide some seed funding, at least, to every one of our network members, to help them keep going and think about creating new ideas. Yesterday, we brought in people who advise on how to get more funding from philanthropy, from foundations, from industry. So there's a lot of work that we can do together. Howard, what do you think about academic institutions? What should academic institutions do?
Well, I love academic institutions, Victor. There are some excruciating decisions to be made now, and I think that's true for all institutional leaders, whether it's at universities or at foundations who have to dispense scarce funds, or whether it's private individuals who want to know where best to put their energy. But I think in general, academic institutions need to double down on their core values and their core activities. So that means finding funding for research as much as is possible, and prioritizing research so that as funds become scarce, we do the most important research that needs to be done. It means finding funding for training. As John made reference to, young people who want to move into careers in climate and health are finding their plans upended now as funding is cut back. So looking hard to find even small amounts of money to help young people with their training. And to the extent possible, working climate and health instruction into curricula in other areas. So for example, in medical training, you don't need to have a climate and health fellowship program. It's great if you can, but you can teach a lot of climate and health insight in the context of conventional medical training. And service, the partnerships with communities that we just referred to can and need to continue. I think we need to tip our hat to the academic institutions that have stood up and taken a principled position, doubled down on their mission. So I think transcending all of the specific activities is the need for revisiting and reaffirming the core values of academic institutions and of demonstrating courage and leadership.
Thank you. I certainly feel very strongly that way. My feeling is the academic institutions are there to advance knowledge, to serve the nation, to educate next generation. And what more important area than climate and health, right? So if you don't commit yourself to these core values, then you're really not serving your nation or your mission altogether. So you did a lot with hospitals and health systems, John. You started the White House Pledge, right? And you provided tremendous support. What do you hear from now from the health sector, the hospitals, the health systems, the others?
So, what's extremely heartening is that I'm hearing from, many of the health systems, many of whom are in this room, the ones that are leaders, the ones that have made the commitments, the pledge or Practice Green Health, et cetera, the Climate Healthcare Council, the movement, are staying the course. I mean, that is one of the best news stories of today is I'm not hearing people say, boy, what a mistake I made signing up for your pledge. See you later. Everybody's staying the course. The flip side of that, though, is that, of course, those of us in climate and health see all of the climate and health damage being done. But, the leaders of hospitals and health systems and community health centers are facing unprecedented cuts to Medicaid, unprecedented threats to Medicare, unprecedented cuts to so many of the subtle ways that institutions get funded, whether it's the overhead costs with research that funds so much of a medical school. All of these things are being threatened. And so, one of the greatest challenges of working on climate change and health is that health always seems to have a crisis going on of some kind that seems very immediate, seems much bigger than climate change. Climate change is 40 years, it's very easy to put off something as abstract as climate change when, your reimbursement's getting cut, when there's a threat to all of this. So, this is our challenge, is to keep our eye on the ball and also to continue to make the case that Medicare costs are being increased by climate change related threats, that these are not two siloed problems, that that the leadership of healthcare should not be thinking about Medicaid with one side of their brain and climate change with another side of their brain. They're intricately linked, and making that case now, I think, is one of the opportunities we have.
Yeah, I think it's all about improved health and health outcomes, right? And I think the health system and hospitals are there to understand that we address the issue of resilience, of chronic disease. Their patients can be better outcome by far, right? And so when I speak to many of the CEOs, they stay in the course. They realize, of course, number one, how important it is to central their mission, which is about patient care and better outcomes. But also, I think the investment they're putting in, as you know, we've done many business cases to show that over time, the investment will actually comes out with return rather than just cost alone. But of course, during your time, there's so many more stimulus dollars to enable people to do this, and this may be more challenging at this point. So, Adrienne, talk to me a little bit about the communities, particularly in the vulnerable communities, right? And how do we tell us more about your work to begin with? What are you doing there, and how can we help?
For asking that question, because there's always places where we can have partnerships and get assistance. I am as you heard, the Vice President for Environmental Justice and Health and Revitalization and Resilience. And in that role, we want to ensure that disenfranchised communities receive the assistance that they need. Of course, in the last administration, we saw the best attention given to these issues than we had as long as I've been doing this work, which is more than 30 years. I know I look young. I started as a child. I feel that one of the things that we saw that's very important is the importance of community science, right? The information that communities have. And that's one of my fears, is that that's going to fall backwards and become not such an important issue. And that's something that we need to recognize in our professions. And I know I met Howie actually when I was in academia at Florida A&M University as a professor, and we had worked on a grant together that I took over from my then boss. And, just finding ways in funding opportunities or finding ways in the work that you're already doing to incorporate communities and community input is important. We have created one of the things that we've created is this. Why did it just leave my mind? Sort of like your CCN, but a bit different on a smaller scale, where we have our clean economy sort of community that's created with representatives from different communities, from policy, from those doing environmental work. But we have virtual roundtables now since COVID, where we talk about the issues of the day. Our most recent one was a few weeks ago, and the discussion was policy and where we are now and how it affects us on the level below. And John just talked about Medicare and Medicaid. I am currently taking care of my mom, and I've moved to Florida to do that. So, of course, issues around Medicare and Medicaid are personal to me, because that's the conversation I have to have every day with the hospital that she may be in, or the nursing home, or whatever. And I know that my colleagues are going through the same thing. So when we think about how these things affect people on the ground, I think then our approach is going to be more encompassing. So that's what I would ask, is that when we think about an issue, we should be thinking also about, and I'd say this at work all the time, who does this affect most? Who will this impact most? Because communities want three things. They want to know what it is, how does it affect me, and what can I do about it? And even something that may seem very simple, which is telling their story or telling their truth, is very impactful and very important and can motivate a funder. And so I think thinking about ways to incorporate community voices is something that is assistance that I would ask for first.
Yeah, I'll go beyond incorporation. I think it's co-design and co-develop solutions.
Absolutely.
Right? Because you're trying to serve people in the ground, and different communities have different challenges, right? You can't simply say, this is the way to be done. So if you go there and learn what their needs are and how to co-design solutions, that's the key. As you said, also bringing in other people with different expertise and resource to support them, right? That's what we did with CCN, because we've gotten people looking at what we call strategic partners, whether it's from government agencies, philanthropy, private sector, to say, how can we help you find your solutions? That's really effective. Howard, I think an important part, of course, as we talk about academia, is research, right? There's so much information is needed, so much evidence is needed, so much data to be collected. Tell me a little bit about how you're thinking as a path forward.
Well, thanks, Victor. Research is a challenge. We are likely facing a substantial reduction in research funding from a base that was only just beginning to mature. That means a reduction in research activity and a reduction in research output. So, in my view, our short-term priority ought to be research with immediate real-world implications. And I would suggest three. And I know we'll be talking about this for the rest of the day. One is implementation science, research that reveals what works to protect health. What extreme heat preparedness plans most effectively reduce mortality? What indicators best predict infectious disease spread? What crops and agricultural practices best buffer the food supply against reduced production and nutritional quality? What therapeutic strategies best manage climate anxiety in young people? Answers to questions like those allow us to protect health directly and soon. Second, climate communications research. We live in a communication landscape that is increasingly cluttered, polluted with disinformation, and bellicose. In that environment, what communication strategies best reach various publics with accurate information and best motivate concern and constructive action rather than cynicism, partisan rancor, and despair? And third, policy research. Our nation has just launched a vast policy experiment, federal abandonment of climate mitigation and adaptation efforts, including abandonment of climate-related health protection. What are the impacts of this experiment? What programs and policies, when terminated, most impact health, and how? What programs and policies, perhaps in improved form, will be most important to rebuild when the time comes? So implementation science, communication research, and policy research, in my view, would be our top research priorities in the short term.
Yeah, you're spot on because the Academy, together with Kaiser's support, is releasing a research opportunity agenda report. It's coming out, I think, even as we speak. And there's a companion New England Journal of Medicine paper about what are the research agenda that we all need to focus on. And I think many of the things you talk about is exactly the areas that we suggested. So on research, I want to point out that there are foundations now coming together, stepping up, particularly supporting research. That's Wellcome Trust, Rockefeller Foundation, Novo Nordisk, and Gates Foundation, right? Together, they have pledged a significant amount of money to support climate and health, but their focus is very much on research, but also in global South research. I think it's important to point out that's where the opportunity is. So this is a thing about path forward. Go ahead.
Could I speak a little bit to the research question too? First, totally agree with what the priorities Howie has laid out. And in fact, the implementation and evaluation science was a core part of the NIH Climate Change and Health Initiative. And so there was a signal that went out to the community. And I think there's a lot of projects that are, in proposal or funding that is being rescinded. So I think there's definitely, I think the philanthropies, I'm going to say something. I hope there's no offense takers among philanthropies here, but I think we're in a state where we need bridging and Band-Aid funding. And there is a tendency of every government agency, but also every philanthropy, to want to have something that they can claim as their own. Like, we did this, and isn't this great? Look at our annual report. But this is where the collectivism has to come in. I think that we have to band together to do the Band-Aid, to be able to preserve the infrastructure, the human infrastructure, the knowledge infrastructure that we have. So, I just want to make that point that there needs to, yes, everybody needs to have their idea, but there needs at this time to be an emergency collective effort to preserve the infrastructure that was being built. The second thing I want to say is that the other opportunity space now is going to be within the innovation and venture capital space. That is inherently going to be solution oriented. It may be high risk research, but I'm seeing this. I'm seeing startups. I'm seeing companies taking a look at innovation in worker protection, innovations in protective equipment, innovations in solutions. And I think that's another opportunity space for people in this field.
Yeah, speaking of that, I know you're very focused on Scope 3, right? And procurement also. And what are the innovations there? What are your thoughts going that direction?
Well, with procurement, we're talking about a lot of different levels. And of course, our office was working at an international level and the level of national health systems at a time when the U.S. was looking at, procurement standards for its government contracting. That movement is still there. So I think, at that level, there is still a really important course that needs to be stayed, where many countries in Europe and across the world were starting to set, this is a little bit jargony. So what we're talking about is people who are buying drugs, medical supplies, medical equipment in large quantities, setting standards for their suppliers for reporting on their greenhouse gases and having science-based targets or other kinds of emission reduction targets in order as a criterion for doing business. That's what we're talking about in terms of procurement standards. When we had strong governments doing this, that was the right place to do it. We certainly have initiatives going on, like the Sustainable Markets Initiative, like the CHARM Initiative, where the private sector is coming together to set these kinds of standards. And I think that we need to kind of double down on that and see that, all the way, it's something that any institution can start to do. But I think, again, we need collectivism. We need the large purchasers to do it, the group purchasing organizations, but then probably some collective work within the private sector to, again, reinforce that this is the way we need to be doing.
Now, how do we do this now, given the fact that you were leading this whole initiative through the government, right? And now without OCHI, how do you think we can move forward with this?
Well, I'll say, Victor, I appreciate your inference that Ochi was really making this happen. But we were trying to work with with the federal government on the health part of this. But I will say this was really something. First of all, NHS England was really and the legislation passed in the United Kingdom was the biggest driver of this international movement. But the private sector work is going on because the private sector recognizes the need. Of course, there's two policy angles that relate to this. On the one side, this was being driven by countries, but then in the United States, we have states and cities that are setting requirements for greenhouse gas reductions among businesses that are, they're doing at a local and state level what we were talking about doing at the national level. And that's a signal to industry that they have to start thinking about what they do to come into compliance with that. The flip side of this, the stone in the pond, if you will, creating the waves is what's going on with the tariffs. Tariffs are upending it was already going to be a little bit of a challenge because sometimes the suppliers who were very much on board in reducing their emissions maybe were a little more expensive at times than the suppliers who weren't caring about their environmental performance. And that was there was a cost factor that had to be figured in. With the tariffs, all of those calculations change. And I'm not in that. I'm sure people in the audience can say more to that. But that's really going to be, just the knuckleball in the game.
Yeah, but maybe we should say a word about the private sector then, right? I'd love to hear your thoughts, or Adrienne, your thoughts, or Howard. Here's my observation. When we have this grand challenge, and of course the collaborative, I think we're just so excited that this is a true public-private partnership. We have some of the best people at the table to say, let's work together. As you know, we look at education, supply chain, healthcare delivery, and of course, metrics incentive. So when all this is happening, I thought the private sector would start pulling back, right? The pressure's off. We don't have to worry about reporting. There's in fact pressure the other direction from the government to minimize this. I was surprised to see how really committed they are. At least for our collaborative, everybody's staying in. They want to do the right thing. It is the right thing to do, and I'm very encouraged by this. What's your observation?
I just want to give a quick shout out to the supply chain working group of your climate collaborative, which is pushing in this space and helping to make it easier for the private sector to stay that course.
I feel like education is key in that early in the process, people were being educated on the importance of their role. And now they know that's something they want to step into because it's needed more now than ever before. Because I've seen that also, even though, funding is still an issue, that you do see people willing to step up and step in. And they have, ever since for example, the Tic Tacs were sort of released by EPA, people stepped in from philanthropic organizations and private entities to say, how can we fill any gaps? Where can we step in? And at that point, we were still trying to find our footing. Of course, now, we can list a number of different ways that they can step in. But I think that the most important reason people are willing to do that is because they've been shown, or people have provided examples of how impactful their involvement could be and how important their involvement in partnership is, and how even though it's not a place they've been in before, just how necessary their presence is. And so I applaud everybody who's worked with these groups before, because I think that laid the foundation for where we are now, and and that has given us more hope than one would have expected at this particular juncture. So,
yeah, you talk about education, and I think about, people think about the classic education, which is you show data, you give talks, you communicate. But we learn, of course, education and communication have to change so dramatically, right? A lot more storytelling, coupled with data. Howard, what are your thoughts about narratives and communications?
Well, let me address the education question, Victor. We are in a tough situation because of all the pressures on academic institutions and training programs, as we just referred to. Fortunately, we've created a cadre of brilliant leaders over the past few years, many of whom are in the room there today. They are in academic medical centers across the country. Now is their moment. Those leaders need to weave climate change into their teaching and patient care, even without formal funded structures such as fellowships, to continue to inspire the next generation of students. That training ought to continue over the next few years. Professional organizations such as medical specialty societies can address some of the educational needs we've got by prioritizing training on climate and health. And it pains me to say this, but let me say that young physicians, nurses, and public health professionals who aspire to careers in climate and health may be well advised during the next few years to study overseas. There are leading institutions in the UK, in Germany, in Sweden, France, Australia, Brazil, and other nations that offer excellent training. So this may be a time for us to be a little humble in the United States and to recognize that there are terrific training opportunities elsewhere in the short term.
Yeah, well, there are many dimensions to this issue, isn't it? One is, I think there's pent-up demand and excitement about being educated about climate and health. In fact, in our initiative, in the education work group, we work with Cecilia Sorensen from Colombia. We're creating these regional educational opportunities, and the sign-up is really quite amazing. But also, I'm talking about the greater issue of narratives, being able to educate policymakers, the public, about the importance of climate change and health, right? We need to find a way to communicate effectively.
Yep.
So there's tremendous movement across the country to say, this is something we must do. Any thoughts?
Well, this is something we've been thinking about for some years. And, you know, I wish we had made more progress over the, at least the 2 decades since the World Health Day that was dedicated to climate change, 2008, than we have. I think, memory is strongest in a setting of trauma and crisis. I hate to say it, but that's kind of the way people learn. That's kind of the way policy gets made in this country. All major policy, or many of the major policy advances in public health and in disaster and in emergency management are reactive. We are inherently reactive. We are not great at proactive. So I think that we have to really focus and be strategic and double down in our communication strategies when we face the inevitable crises that we will be facing. This summer is not going to be a summer with a climate of 1942 just because people would like to go back to 1942. It's going to be the summer of 2025. There will be heat waves, there will be hurricanes, there will be wildfires. And I think these are our opportunities for describing the impacts of the decisions that have been made, describing the impacts that, and as much real, tangible, on the ground, talking about the people who are, not being heard but are suffering, and articulating the solutions, continuing to articulate the solutions.
We can take a few minutes to have all of you to have, if you've got any questions, please go up to the microphone. We can take about 5 minutes for a Q&A from all of you. Any questions? Gee, awfully quiet. Okay, so I think the question for me is, this session is called The Path Forward. I'd like to turn to every one of you and say, what is the path forward? Right? Let's start with you first, Adrienne.
I think that the young lady was about to stand up in the red jacket.
Please.
I saw you.
I guess one of the things I'm really struggling with is when I want to tell people what's been cut and I cannot figure it out, right? Which part of the heat.gov isn't working? Which part of NOAA isn't working? Of the cuts in the block grants in Nevada, which is where I work, like what agencies are going out? And I can't really do it in a detailed way. So I was wondering if you guys had any advice for sort of tracking that?
I'm not sure precision is essential. You know, the first issue is that the cuts are being fought, and so as Adrienne's saying, many of the cuts, we're hearing kind of incredible to comprehend that some of the cuts are mistakes. We didn't really mean to do that. That letter that you got, oh, sorry, that wasn't a real letter. So it's a confusing landscape, and it's a deliberately confusing landscape. I'm not sure we have to be super precise. I think you can say with confidence that all of the systems that are protecting people from climate change impacts on health and health equity are under assault. I don't think you have to say this one's gone or this piece is gone. I think you just need to say that offices are being closed, people are being fired wholesale. The professionals who have dedicated their professional lives to public service are being sent out on the street with little warning. That's the reality. Exactly. You can never we're in the smoke of war, right? Like, you can't see exactly what's going on. You just know that you're in a war. I think that's what we need to be articulating is that we're under attack.
If I can add, I think we also, at least for me and my program, I make assumptions. Cuts to NOAA and FEMA are going to affect the communities. And I'm going to go back for because it's easy and sad, to evacuations. So we're not going to get information on, I'm going to assume that we're not going to get necessary information on Category 5, Category 4 hurricanes in a timely fashion, if at all. We're not going to get information on sea level rise like as we were before, except that people have gathered data and created databases off to the side that if, as we find out about them, we can access them for more information. But I'm always going to operate that this is a data gap that we need to look for other people to work with us on. And also, as we advocate for the accidental termination of programs and people, right? And so I assume the worst and act on that. And therefore, what I'm doing is shoring up things as in whatever situation they are in currently.
Yes, questions, Steve.
Thank you. Steve Morrison, CSIS, and thank you very much for this discussion. I mean, your call for collective action leads to the question of what is the political strategy going to look like? And there's a couple of different dimensions to that I think could use a lot more discussion. One is there a latent constituency in America that has lived through many of these climate disasters that has not really been tapped yet? We know there's court contestation. We know that the Democratic Party is going through a process of searching for what its vision is going to be. And we know that there's going to be a period of popular opposition, popular mobilizations across the country. So how are you going to shape those different dimensions of this? And last is, how are you going to build support among conservatives for all of this and not wind up being an isolated partisan, living in a partisan bubble going forward? Thank you.
Thank you for those excellent comments. Howard?
Yeah, those are exactly the right questions to be thinking about. And this leads into the path forward question that you raised, Victor. I think we need to be planning essentially an Agenda 2029. So when the time comes to rebuild, and it will, how do we build popular support? How do we craft the narratives that pull us together as a society rather than divide us? How do we identify the most effective programs? And we may be able to build back better so that some of the best climate and health programs across government actually are more effective than they have been up until now, given the opportunity to do advanced planning. So I think one of the main actions in the path forward is planning for the rebuilding, which we will have to do in just a few years.
Thank you. Let me turn to each one of you about path forward. Adrienne first.
Sure. For me, I think that the most important part of the path forward is to be willing to think outside the box. Perfect example, a few years ago in the UK, a mother who I spoke with was able to get her daughter's death certificate, cause of death changed to climate change. She died from the asthma attack. And, you know, that's impactful. And it's also something that we as, well, you as physicians and people working in that space, and us as health professionals need to consider. It's a small example of a bigger problem. Also, I think that illustration is the best, you know, illustration of a real truth is the best tool. You know, when you start talking about lives lost, then it's not my role to try to convince everyone to the side. I gave up on convincing people that climate change was real a long time ago. And those people who believe it and who feel it are the ones that I focus on. How can we work together to address this? And knowing that those who don't believe will believe. So going forward, it's, of course, I always say non-traditional methods and keeping an open mind, thinking of partnerships outside the box and other people who may be affected, but always realizing that we have tools. You know, we're not powerless, we're powerful, right? So when programs are dismissed because of environmental justice or DEI, fine. If we're looking for a path that creates a safe environment for everyone, let's hold people to that. Because in doing so, we're addressing the disenfranchised. So let's hold them to that larger term. And so it's about thinking strategically and differently for me.
I was going to ask John talk about path forward, but I see, is it Beverly? The question, why don't you ask the question then?
Yes, Bev Malone. I'm the president and CEO for the National League for Nursing. And thank you so much for your presentations. I'm honored to be here and to listen to you. And you are our lights, sort of lighting the pathway. And I was wondering, what do you drink in the morning to keep you going? What superpower are you pulling into that you can remain our lights as we keep moving forward in a time of a lot of darkness?
Thank you. John?
The lovely thing to say and to raise, and in fact was going to be part of my path forward, which is, you know, I drink in support from a community every morning, and I'm very blessed to have that, and we're all blessed to be cognizant of that and to know that we all can drink that in every morning. So, you know, I think step one of the path forward is self-care, is to realize that we're in a really unprecedentedly traumatic situation right now. The answers to you know, to the questions of, you know, how are we going to get the Republican Party on board? How are we going to find the money to support, you know, everybody who's out of work? How are we going to continue to lift up the communities? Those answers may not be that apparent right now, and that's going to have to be okay. We just have to know that we're still walking forward and that we're still on the right path. So that's the short answer. The other answer is decaffeinated coffee.
Yes, last question.
Thank you so much. Priyanka Suryo. I'm Director of Resilience Informatics at EMI Advisors. We're a tech and innovation consulting firm. We do a lot of work on data standards and interoperability. So my question is actually about the data gaps that you mentioned, Adrienne, and also I want to draw that connection to communication. I want to hear a little bit about your thoughts about using data to tell the story, especially for those who are not bought in, whether that's economic data, whether that's lives lost, and also kind of weaving in data preservation efforts as well. You know, one of the things that we've kind of understood is that there's not a lot of standardized data in this space, but it is important to start to show that connection between the exposure to climate change and environment and its impact on health. So I'd love to hear a little bit more about what we can do from a data perspective.
Well, and I'll be quick. You know, we look at data, we being the environmental justice community, I think it's easier to recognize data gaps to date. The important part of your question is that there's data out there that everybody doesn't know about, some things that I've been finding out about. And that's what we need is a method where we can know where to go for information. When it comes to communities and data, getting that information from them about what's lacking, or if they have filed, for example, a particular type of complaint and they were told you don't have the data, the scientific data to back that up. Okay, what is it that you need and how can we get it? Or can we get it? Or do you already have it, but it's just, it wasn't done scientifically, right, by a science body? So, that's the sort of information that we need when it comes to data gaps. And during COVID, it was about who's dying and where and how and from what, right? And was it people who were already exposed to because of where they lived, and then it was exacerbated by climate change, and then that led to making them more susceptible. So it's also making interrelationships and making linkages between connections. So.
Yeah, so time's run out, but I would say the following, path forward. When I look at this morning and yesterday and all of you being here, I feel so encouraged. I think clearly the path forward is a sense of commitment of all of us to this area. And I see this in every one of you. We have to stay the course. And obviously, we should ask a question, what should this look like 2 years from now or 4 years from now? And I would say I'm more optimistic than, of course, right now we're seeing this avalanche of things coming at us. Has been suggested to many of you, we need to be better organized. We need to be much more committed. We have this network of individuals. We're all working in different parts of our sector to move forward, whether it's health, whether it's community, whether it's other types of organization. I think the important issue is to understand what this is all about. My belief is that, of course, all of you I've been around longer than many of you, seeing cycles of changes. These will come and go. And I'm not saying that this is just a transient thing. And of course, we're all worried about the damage it will be done by this surge avalanche of things coming at us. But I think, as been pointed out, we need to think about how to rebuild this, the readiness to rebuild. So to me, it's leadership, it's networking, it's a community, it's commitment, collective action, of course, innovation, and readiness. And it takes a lot of commitment to do so going forward. And I know all of you have it. So, as been said by Howard and others, let's get ready to rebuild this all together, or at least keep this moving forward. And then when needed, we'll rebuild the entire the initiative effort going forward. I want to thank the great panelists, Howie, Adrienne, and John, for a really outstanding conversation. Thank all of you for getting us started in the right way. Thank you.